This afternoon, in the health sector, pressure is mounting on government to release the needed funds to the Korle-Bu Teaching Hospital to help manage their existing debt and also allow the health facility to reopen the renal dialysis unit to outpatients. It's coming at a time when the CEO of Korle-Bu Teaching Hospital, Dr. Korle-Bu Renal, is revealing that the unit owes 4 million cedis, the reason for which the renal dialysis unit was shut out to patients. Here is more.
We've been under recovering for some time now. As I said, our prices were set about 3 years ago. So this, and you should also appreciate where we've come from. When dialysis started in Korle-Bu, the average cost per session was around about $100 per session, equivalent of $100. And now the price has come down considerably. As of today, but the current, we are under recovering for the current price. And so we also need to, much as we sympathize with the patients, we also need to keep the service sustainable. And so First Sky support has been very, very tremendous in helping us to be able to provide service for about 80%, free dialysis for 80% of the patients that we treat. Unfortunately, because of the increase in the cost of the consumables, not the increase in the cost as such, because in Forex it's the same, but when it comes to the CD equivalent, it's gone up. So we need to, make those adjustments. And so that is so. In fact, as we stand now, the renal unit has a deficit or has a financial deficit of 4 million cedis that we need to, that we are trying to find ways of.
Is that debt?
Yes, that's
or you owe a supplier?
No, it's debt. Yes, debt that we owe.
How do you accrue that? How was that accrued?
It's because of the under recovery from the service that we are providing, and so to continue to run at full throttle would mean that with this debt is going to balloon. Okay, and that is why there was a need for us to look at adjusting the price, whilst we also engage with the next relevant stakeholders to see how best this deficit can be met.
On that thought leadership roundtable, presidential advisor on health, Dr. Nsiah assured that government will intervene and deal with the situation. Sadly, the situation remains the same. Frustrated members of the Kidney Patients Association say their lives are hanging on the thread as the renal dialysis unit at Korle-Bu Teaching Hospital remains closed to outpatients. They are asking for help.
Kidney patients who patronized the Korle-Bu Teaching Hospital's renal unit for dialysis were full of hope following the assurance by health authorities that they will intervene to reopen the unit to OPD following Joy News' fourth leadership program on the dialysis crisis. After several weeks of assurance, the unit still remains closed, causing distress among people with kidney conditions. The affected patients say their conditions keep worsening by the day. Reverend Daniel Hammond speaks for the patients.
As we speak, the cabin is still closed to outpatients, and that is having a devastating effect on the patients. The death toll has risen from 14 patients of our last press conference to 19 patients. Lives are being lost needlessly due to the lack of adequate dialysis.
They are making a passionate appeal to the government to expedite its intervention in order to restore the unit to its former state.
We humbly appealing to the government again to help us and ensure these 4 things. 1, to provide the needed support for the unit at Korle-Bu to settle indebtedness of 4 million Ghana cedi to suppliers, so that OPD cases can resume at Korle-Bu Renal Unit immediately.
Aside from the appeal to government to open the renal to OPD, the patients are appealing to corporate Ghana, NGOs, religious organizations, and philanthropists to assist them in footing their medical bills.
Well, let's get more on this. Joining us now is a member of the Kidney Patients Association of Ghana, Kojo Ahinkra, who's also part of the leadership mounting pressure on the management of the hospital to deal with this situation. Kojo, it's a good time to be talking to you because many just do not understand the gravamen of the issue at stake, the fact that your health matters most at this time. How challenging is it for a renal patient trying to assess healthcare at the Korle-Bu Teaching Hospital now?
Thank you very much. Currently, there is nothing like there's accessibility there for the outpatient. Right? I mean, let me be more specific about outpatient. We are normally about 250. The place was closed down to us May 22nd of this year. And as we speak now, it's still not open.
And for the information of the public, many are not aware that this is just part of the very few centers that treat carry out the dialysis treatment.
Yes.
How bad is the situation now for many of your members?
Very bad because, Korle-Bu, because it's a public place, the price was a bit more moderate, like what you just paid. Right. But those outside are now private and they are charging to make profit. So you can imagine, the least you can get is about around 600 per section. Most of us are doing 2 to 3 sessions a week. Ideally, the NC people are supposed to do 3 sessions a week. But because of financial constraints, all of them are doing 2 sessions a week now. Yeah. So it's very, very, very bad.
I recall you being part of that thought leadership program we did here on the Joy News platform. The CEO of the Korle-Bu Teaching Hospital was here. The assurance was given that the problems will be dealt with. You're surprised that nothing is happening?
Sure. Nothing. I have been speaking with the Korle-Bu CEO. All what he made me understood that there are things in place. They are working on things. Because if you quite remember, they said that if they are supposed to go by the 380, that is the old price, then there will be some cutoff, which they need to refund that money. So the analysis that he does was that money will be like around 900 and something. I've forgotten the figure. That if they allow us to do the 380. Yes. So he's saying, and then there's another option that either we go for 550. That one too, there's supposed to be a subsidy of about 400 and something. That one. So now the thing is on the table for government to choose whether we are doing the 380 or we are doing the 550. Still, we've not had anything.
As renal patients, are you willing to take up the full cost if it will mean that the center would be reopened?
Nobody can sustain that.
Right.
It's not sustainable because the dialysis is a lifetime something unless you go for transplant. So maybe if you're not going for transplant, you are going to be on the machine. For me, I've been on the machine 8 years. My account is 0.
That will mean more cost to you.
Yes, more cost. Now my account is 0. So even if you have thousands of money, the more you go. So if some does not come to add up to it, there you go. So the best thing we can do, the government have to step in. We are appealing to him. We can't fight him. We can't do anything. But we are losing lives. As at the time we did the first presser, it was 14. Now we have 19 people gone.
Right.
So you can imagine. We don't even know. We heard this news from Dr. Okuboy that they were supposed to move to the
MHI. That was another consideration on the table. Any news yet?
We all hear from Dr. Okuboy is going to take them between 6 to 12 months. That is a year. So you can imagine within that time the number of people that we are dying. So there should be something. Something should come up right now so that whilst they are constrained that, at least, those with the kidney cases can have some lives in there because it's not.
It must be really challenging for you. We're wrapping up the conversation, but you are also in that lived experience. What message do you have to the authorities who are watching us now, and what would you want them to know about how delicate and serious this issue is?
Okay, thank you. It's three things that we are appealing to the government to do. The first thing, they should look at the taxes on the consumables and the dialysis machine. Now, let me do this simple mathematics. If they say, okay, they are going to help Korle-Bu, just in Accra here, we have about 10 to 15 dialysis centers. All of them have their patients. Now, any sensible person, once Korle-Bu begins to do something very good, everybody will move to Korle-Bu. So the pressure will be on Korle-Bu. So if the taxes are moved off from the consumable, the private sectors can also bring their prices down, whereby people can easily go there to afford it. That is the first point. Secondly, if the government really is going to do about the subsidy, please, they should fast track it for us. We beg them. And then lastly, you see, we are begging these big churches and other believers, we are begging them. This church, Baker's Chapel, Bodin Abiche, came to do some donation to us. They should emulate from him. The Church of Pentecost, ICGC, Duncan Williams. They should take one Sunday, when they collect all the correction, they should come and give it to us. So that at least it can also pay the 4 million the Korle-Bu CEO was also talking about. These are the 3 points we put across. We are just.
I see. And that challenges on Joy News is definitely joining the challenge. Could you thank you? And stay strong. We'll definitely be raising that awareness. You can also support the renal patients so they can, support the dialysis treatment. We will be crossing over shortly to the EC's press briefing. But just before we even do that, could you? I almost forgot about this. The point about dealing with the other health facilities, those of your members who are up north. What are you advising them as a society to be doing now, even as this center is not available? Because many of them have to come from up north down south.
Per the information we have, the Tamale Regional Hospital has got some, I think about 5 machines, which they are doing it there. But I learned the patient rates keep going up. So once again, the government to all the regional hospitals, they should put dialysis machines, because in our case in Korle-Bu, we have about 2 people. One is coming from Begro in the eastern region. Another one is coming from Kibi in the eastern region to come and do the dialysis in Accra. So if Koforidua is having maybe about 6 or 10 machines there, they wouldn't travel all the way to Accra, you see. Yeah. And then those of us in Accra to find Kumasi is doing well. But one thing is that those people, they are still maintaining their charges, but Korle-Bu keep going. But I understand Korle-Bu. The machines that we are using is one of the latest, the Physianos has given it to us. And so once you go on it and you finish, you can see that
it's easier, right?
Yeah, clearance.
But the private health facilities, is there anything, any window in terms of negotiation that you can explore with them in the meantime? Have you tried that?
Oh, I mean, they have already gone for the consumables. Right. They've paid taxes on them. So you don't expect them to lose. The only thing I would suggest is that I think Korle-Bu or maybe Ghana Health Service, or they should get a monitoring team to monitor these private dialysis centers, because some of them, I'm not an expert, but what I know is that I think they are not doing well. They are not doing well with the treatment. I mean, dialysis is about water treatment. It entails a lot. If the water is not good, you are even killing the patient. Right. You are even killing the patient. So that is another thing I'll also put across, that they should get a monitoring team to be monitoring these private dialysis centers. Because we cannot have any negotiating with them. He is going to bring his things down. He wants his money. You don't expect him to lose. Even if Korle-Bu wants to break even, how much my private center?
In the coming days, what should we expect from you? Since you're pointing to us that, well, you've tried, you've spoken to the CEO, you've tried other means, you don't seem to be getting any result. Is there anything you're planning to do as an association to raise more awareness?
Oh, yes. What we are trying to do now, I think we need to go to the private sector. Since it's all about money, the churches, like I just put that pay like that. That's what we want to go to them. Like he said, First Sky is doing a lot for us. I think he has done a lot for us. But one person. So we'll be going to the churches, other private organizations, to appeal to them if they can help us to clear that 4 million, which Dr. Nsia, as I promised, we've not heard this from them. That we promise if we can clear that debt, and then we want to have a fund so that maybe some donations can be going in, so we can fall on it to be supporting.
Well, Kojo, we'll definitely be on this matter and engage again.